to second episode of SpeakMED Season 2. I am your host, Nordini Izati binti Rasidi. Medical Talk is all about giving you the truth you need to make healthy lifestyle choices. With me today to discuss about sexual transmitted disease is our respected Dr. Alwi bin Muhammad Bashari at Hashim. Hello, Dr. Alwi, and welcome to
Hello,
Speak.
hi.
Hi, would you introduce a little bit of yourself?
Okay, my name is Dr. Alwi. I'm a consultant physician in infectious diseases at Hospital USM. I was trained in medicine at the University of Adelaide, and later on, I specialized in internal medicine at Hospital USM. And after that, I went for training in infectious diseases at Hospital Raja Perman Zainab at Hospital Kuala Lumpur as well as Hospital Sungai Buloh. And currently, I am seeing and managing the patients with infectious diseases, particularly HIV, patients with dengue and leptospirosis, hospital-acquired infections, and of course now we're having COVID. So I'm heading the medical team to manage patients with COVID-19. So I think that's briefly about me.
Okay, doctor. Okay, thank you for introduce. Okay, so let's get into our interesting topic for today. Okay, let me state the fact. Right? Based on Kementerian Kesihatan Malaysia, sexual transmitted disease cases has rises year by year in teenagers, which is basically.
Sexually transmitted disease or sexually transmitted infection, there are a number of them. The most common include gonorrhea, chlamydia, syphilis, HIV, herpes simplex infections, trichomoniasis, candidiasis. So these are among the commonest type of sexually transmitted diseases. And at the moment, they are on the rise, especially among key population and also among the younger population as well. And this phenomenon is not only what we call it, what we see here in Malaysia or in Kelantan, but it is actually seen elsewhere in the United States, in England as well.
Okay, so that's quite surprising for me. Teenagers also have this type of infection. Okay, so I want to ask doctor, so like, how common these cases, especially in the hospital in Malaysia?
Okay, sexually transmitted infection in hospital setting is not very common because of they often not requiring hospitalization for most of them. But the patient may found to be incidentally having STI when they are admitted for other reasons. And but the two commonly diagnosed within a hospital setting are the HIV and syphilis, either through the screening from the what we call it screening prior to the procedures, or when they presented with when they presented with a complication or at the advanced stage of these diseases, especially HIV.
Oh, so that is quite common in our hospital. Okay. So I want to know, like, we know like we have a lot of type of sexual transmitted disease. However, like during screening test, what type of STD that we are screening for?
Okay, during screening for medical checkup, or during the screening for for other purposes, the disease that we normally screen are HIV, hepatitis B, syphilis. So these are the diseases that commonly being screened as part of other infection. But these diseases that I just mentioned are sexually transmitted. So so those are the three that commonly screened during the routine screening process at most of the
Oh, okay. Do we provide service for people that come to government clinic? Like, do we like provide service for people that come to government clinic?
Oh yes, of course. The service to what we call it manage and treat sexually transmitted infection is available at all government clinics, and the treatment for sexually transmitted infections are totally covered by the government in Malaysia. So the what we call it the people can just come to any government facilities to be evaluated and examined and what we call it managed if they have symptoms or syndrome related to sexually transmitted infection.
Okay, that's interesting. But like we know, like stigma of the society when they go to the legal, right, with this type of infection. How about the patient confidentiality? As we know that patients are suffering from this, and they will be really particular about confidentiality. They also like request to inform their family regarding their disease. They request the doctor to inform their spouse or their disease. So like how we handle this?
Okay, first of all, confidentiality is part of the professionalism that's supposed to be practiced by all doctors, and all doctors must make sure they maintain patient confidentiality regardless of the situation of the case they are seeing. Okay, however, for sexual transmitted infection, this issue of confidentiality is being emphasized, and it is understandably more what we call it in need of those confidentiality. And to enhance that, the government and in Malaysia, in Kelantan, as well as in other part of the world that I know, sometimes set up a special clinic with certain name that is normally not apparent and doesn't appear to be looking like sexually transmitted clinic. Here they call it um, client-friendly clinic, and I remember in Australia, in Adelaide, they call clinic by numbers of the lot. I can't remember the number now, but yeah, they don't really put the STI clinic or the gonorrhea clinic or things like that. So these types of what we call it labeling branding is one of the efforts to reduce the stigma and to improve the patient's confidence and security when they do attend this clinic. And of course, when they see doctors, especially those who are post or who are rostered to look to cover for the clinic, is especially trained to make sure that the confidentiality is at its best. And in terms of spouse or partners, there is rules or regulation or law that the healthcare provider has a duty of care to inform the spouse or partners or to ensure that the spouse or partner knew about the status of the partners being infected with STI. But whether the doctor needs to inform or the patient, there is an option. The patient can choose to inform themselves if they are happy to do that, provided the doctor can verify that the process was actually done. And the reason for that is mainly because of the healthcare providers has a duty of care to provide treatment for the spouse who may be unknowingly also been infected, and to ensure that they're being diagnosed early and being treated early to prevent future complication.
Yeah, I think that is the right to do because spouse also have their rights to know about their another spouse health. Okay, because this involves dua belah pihak lah, right? Okay.
Exactly, true.
Yeah. Okay. So I want to ask about what about the stigma against the STD? especially stigma that doctors think and when treating patients? And how about the religious concern?
Okay, yes, I think, of course, I mean, um, when we practice medicine, we are trained to treat the patient. We are trained to treat the patient with the disease, and when we treat the patient with the disease, we focus our encounter, our activity at treating the patient with the disease. Okay, and of course, certain disease may be associated with certain behavior which is not, which is not in accordance to the religious regulation, and we as a what we call it as a doctor have to um, what we call it function professionally in terms of treating the patient and the disease. Um, the religious aspect of it, we can offer advice if that's being asked by the patient, or we may refer the patient to appropriate appropriate body or appropriate what we call it person if the patient wanted to get religious advice in relation to their behavior. Apart from that, we have to still maintain our professionalism in terms of focusing the treatment to the patient and the disease. Okay, for the doctors, even if we treat, one of the things that often being raised is whether if we treat the patient with sexually transmitted infection, whether that will affect our religious adherence in terms of collaborating with the so-called sinners, so to speak. But my view is that we treat the patient with sexually transmitted infection. We are doing the religious duty by preventing transmission to other people in the community. That is part of the religious duty as well. We can offer advice for the patient to change behavior as part of an advice from another person. But again, we are in no way going to impose our belief or our position to what we dictate the way the patient is supposed to behave. But as a person who are honestly and who are sincerely having a concern for the patient, we can advise the patient to modify their behavior, because continuously behaving in such a way, not only it is what we call it contradiction to the religious teaching, but it is also continuously exposing them to future infection, other infection that may affect their health as well. So that is my point of view.
So I think what I can say is two parties have like responsibility. We as a doctor give advice to patient, and also like have responsibility to like take action to ensure what the doctor says, right?
Yeah. So our role is to give the best medical advice, and that the best medical advice is for them to remain healthy and to remain safe from the damaging effect from the diseases. So that is our primary aim and primary what we call it content of the advice.
Okay, I think like that is interesting between the relationship of the doctor and the patient. Okay, so like there is a saying say that an ounce of prevention is worth a pound of cure. Yeah, maybe a doctor can like discuss a little bit about the early prevention of the sexual transmitted disease so that we can give like awareness to society.
Yeah, I think the sexually transmitted infection is or sexually transmitted diseases are completely preventable. I mean, many infections that occur outside It's not totally preventable. Dengue, for example, it's not much you can do to prevent it individually. At a community level, there's certain thing that can be done, but individually, when there's an outbreak, not much you can do. You cannot stop the mosquito from biting you. Okay, but sexual transmitted infection is completely preventable, and to prevent that, we need to know what are the risk factors for that. And if you look at here, I list down few I list down the risk factors for the sexually transmitted infection. So the risk factors for sexually transmitted infection include number of sexual partners. The more sexual partners you have, the higher risk you are going to get in terms of getting STI. Failure to use condom, frequency of partner change. If they change the partner more frequently, they will have much higher risk. Younger age group tend to have much higher risk than the older age group, most likely because they tend to have more frequent sex and most likely also more vigorous sexual activity. Resident in an inner city, which probably not much you can do. You can't move just to the rural area to prevent it. Symptomatic partners, so if your partner exhibits some of the symptoms or all the symptoms of STI, then your likelihood of getting the disease much higher. Sexual orientation is probably one of the biggest or most important risk factors. So if you are men who have sex with men or homosexual, or you are at a much higher risk of getting STI compared to the heterosexual counterpart. And certain sexual practices like orogenital or anogenital contact tend to also increase the risk of getting STI as well.
Okay, so like based on the risk factor that doctor have in the slide, I know that I can guess why there is the statement that I said before about the teenagers have more transmitted disease in Malaysia compared to the older age. So I think I found that is because of the teenagers have more vigorous sexual activity more than older age. Doctor, am I right?
Yes, and they also tend to be more negligent as well in terms of other practices to prevent transmission, like using condom, for example. The study has shown that the younger age group tends to use less condom compared to older age group.
Okay, so like less awareness about that, I think. Okay.
Yeah.
Okay. I think like I guess a lot of people that don't know about the screening test about the sexual transmitted disease or another mana-mana screening test. So maybe doctor can explain about how and where to get this type of screening test, and maybe about the cost that to get the screening test.
Okay, first of all, like anything in medicine, it started off with the symptoms. Okay, so I think those who are at risk should know they could be at risk. Looking at this list of risk factors, so one, if they are, they have any of this, or they have got, a number of these risk factors, clearly they are at very high risk of getting sexually transmitted infection. So the next step is they need to look at the symptoms. What symptoms they have? So, for example, the patient with sexually transmitted infection may present with vaginal discharge or vulvar irritation or pain, urethral discharge in men, or dysuria or balanitis, genital ulceration, genital lumps, lower abdominal pain in women, for example. So they need to screen whether they have the symptoms or not. And when they come to doctor also will ask this question to see whether they have the symptom of the syndrome. Okay, and the next step to do is to take some sample if they do have symptoms. For example, urethral swab and smear for culture, high vaginal swab, ulcer swab if they got ulcer around the genital area. And if they are asymptomatic, or even if they are symptomatic, you can take the blood test for serology for syphilis, hepatitis, and HIV, and also at the point of care at the clinic, most clinics have the HIV combo rapid test, which can be done at the point of care and that can be seen immediately. And if they have lower abdominal pain, they also need to do the pregnancy test to make sure we are not missing ectopic pregnancy, for example, and urgent ultrasound abdomen and pelvis to make sure we're not dealing with what we call it an acute abdomen or surgical emergency.
Like, how about these teenagers have like vigorous sexual activity, but then does not come with symptom? Does he also can go to get the screening test?
Yeah, I mean, if the teenager involved in, if the teenager is actively involved in sexual activity that pose them at risk of STI, definitely it's very useful for them to go and see doctors to be evaluated. First of all, to be evaluated in terms of risk factors so that they can be counseled and advised that make some of those factors that they have are putting them at high risk of STI, which they may not know. Number two, the doctors can look or can ask for the symptoms, and if they don't have symptoms, the doctor can examine, looking at the lumps and bumps, ulcers, discharges. Okay, and if they don't have that, then the doctor can take blood tests to do screening for syphilis, hepatitis, HIV, and can offer the rapid screen test for HIV as well. So that's what they and if all that done and everything negative, then again the teenager can be counseled again, can be advised, and can be made to improve their awareness about the threat of STI out there, because they continuously behaving in that behavior and having all those risk factors, even though they don't have at this particular point in time, eventually they will catch one, and we hope that they do not end up having STI, especially things like HIV, which is essentially incurable, although it is treatable.
Okay. So I think before we going to next question, one of our AMSA member also have question to ask to doctor, which is Daniel Kwe. Daniel Kwe, you may ask the question.
Doctor, my first question is that, so previously mentioned about the religious belief of a doctor and then also the patient. Then they would give advices, right? So, example, if a person come in and the doctor give unsolicited advice, they don't ask for advices, but the doctor is giving the advices based on their own religious belief. What should the person do with it? Because if you go to hospital and then they give you advices about your own lifestyle, and then of course you will feel a little bit intimidated, you will be scared to go to the hospital again. So did they get to request to do it at other places, or how do they get to report if the doctor is actually in some way is like being rude to them?
Okay, right. Okay, of course, I think the doctors, just like other thing as well, there are a variety of them. And yeah, like you said, there could be a situation that someone goes to the clinic and doctor started to give a sermon or the ceramah, I mean, regarding the religious sort of injunction to the patient without the patient actually asking for the sermon, right? So that could be a situation, and for me that is not a good practice. That is not a professional practice on the doctor's part. And as usually what we normally do when we go to a clinic or facilities that the doctors do not seem where in the next visit. Okay, so that is what we normally do. Okay, now in terms of report, it depends on to what we call it degree the encounter is progressing in terms of whether it reached the code of professional conduct or whether it lead to some form of what we call it misconduct. Okay, and that is something that sometimes not very clearly defined to what level somebody communication moving towards from annoyance into misconduct. I think if the patient or the client strongly feel that they are unhappy, then I guess they can report it to the clinic supervisor if that they feel. But if they think that is something that's annoying to them, so they could just decided to go to other clinic in the next encounter. Again, as I said, because of it involved the communication, it involved is the content of speech. The line is not well demarcated. It's based on the feeling of the patient in terms of how far the conversation has progressed, and also because of again sometimes it could be advice, but it could move into sermon. It could move into it could evolve into what we call it instruction or blame, for example. So it actually can progress further and further. So it depends on how the client feels, and if they strongly feel that they are unhappy about the encounter, then they can report to the supervisor or to the superior of that clinic.
Thanks for the question. I do have one more question I wanted to ask. Is that regarding the risk factor? Homosexual activities have higher risk factor. I think we have to address also what actually tendency to cause a higher risk in homosexual. For example, sexual intercourse is higher than heterosexual. Because from my encounter, from what I've heard, like people told me, most of the heterosexual couple, there's not much of the awareness on using condom as in a form of protection against STI. It's mostly as against a protection of getting pregnancy. So that kind of mindset is not implanted into what we call the homosexual community, which is one of the largest contributing factor in HIV because of the unprotected sex. So, doctor, want to comment anything on it?
Okay, I tried to make sure I get your question correct. So, are you asking why does homosexual having higher risk? Okay, why does homosexual group having higher risk compared to heterosexual when the homosexual group actually using more condom because they do not have intention of prevent pregnancy, like hetero only wanted to prevent pregnancy. Is that what you are saying?
In a manner of speaking, is that maybe we are trying to talk about the risk more on the activity itself. For example, protection instead of facing on the sexuality. Because in my opinion, a lot of the heterosexual they don't aware about STDs, but they use condom mainly on the prevention of pregnancy side. So maybe if we actually raises awareness on actually using condom to prevent STD, is it a better way actually to promote safe sex for people since we cannot stop it anyway? So it's better for us to take care of the health.
Yeah. Okay. I think I get your question now. So you're saying that isn't it better to focus the prevention on the method prevention itself rather than on sexuality, because of the method is actually what it's going to prevent rather than sexuality, which is not going to change. Is that correct? Right?
Yes.
All right. Okay. Yes. Right. Okay. First of all, it's a good question. Okay, but I think in public for the general population, yes, that's definitely the approach. The approach is we should emphasize on what they can do to prevent STI, like you said, using condoms, for example. Even there are a few other ways, taking pre-exposure prophylaxis, for example. So those are the things that definitely being done and definitely suitable for general public. But when we talk to doctors, to practitioner, we we also highlight the fact that sexual orientation on itself is a risk factor. It's actually an independent risk factor for acquiring STI. Apart from whether people are using or not all those methods, but this is mainly for the doctors when we talk to, because of this important for you or for us when we talk to the patient, when we ask the patient. It's also important for the patient as well to disclose this if they do have risk factors, because then it will assist us in managing them. But when we talk to the public, of course, we have to emphasize more on the method of preventing the disease rather than about the sexual orientation of someone. So that is basically the reason for that. And here also, like I have here the reason why MSM have higher risk because of there are certain differences in terms of certain things. For example, this study done in the US, they found out that MSM, they started to have sex much earlier age compared to heterosexual, and they have much more partner within 1 year compared to the heterosexual, and they also have more lifetime partner as well. So if we say that both group using exactly the same prevention method, but by the virtue of starting early, by the virtue of having more partner, and by the virtue of frequency, automatically the MSM will have higher risk compared to hetero if we keep the method of using preventive measures constant. Okay, but again, this is mainly for the healthcare professional to be aware of this, so that they could what we call it offer screening and also treatment as earliest as possible for those group that is known to be at higher risk of getting the disease. Am I answering your question, Daniel?
Yeah, I get the explanation. However,
Yeah.
I think it is because in the studies it talks about the sexual behavior as a form of risk factors, right? But I think the focal I'm trying to shine on is that the lack of the actually uses of it. So if we were to make a research like this, and then there's another one talking about how frequent is MSM is using protection compared to heterosexual men, it would show that actually they don't feel like the need of using protection is higher compared to heterosexual men, which is a strong indicator that public sex health is actually failing, because it is not informing how such stuff like condoms actually prevent STIs. Do you agree on that?
Yeah. Okay. You are saying that the public health authority has not been emphasizing as strongly regarding condom. Is that why you're asking?
Yes, especially in the MSM, because if we were to compare, the heterosexual population would use condom higher than MSM community.
Oh, so you are saying that the hetero using higher because they want to prevent pregnancy as well, or that's the main aim, and the reason, and the MSM they use less because they don't have issue about pregnancy. So that's what you are saying.
Yes, I also think it could be one of the reason to those of increasing, because right now we can see actually a lot of women also actually increases in HIV. So it is one of the issues that I think people overlook sometimes.
Okay, all right. Okay, yes, I think I get what you are asking, right? So I think you are saying that the hetero will be using more condom because they also want to prevent pregnancy, and to aware more, so that they use more condom, and the what we call it, therefore the potential rate higher. Okay, definitely I think the public health is trying to do that. I think the campaign of safe sex is like everywhere regarding the safe sex, and part of that, I mean the core of that campaign is using condom when having sex with anybody. Okay, however, from my experience, the I mean the people actually the rate of using condom generally is actually unsatisfactory. The rate of using condom is probably around only 60 to 70%. So there are about 30% of people don't use condom, and the rate is actually lower when they think that the one that they've been having sex with is supposed to be clean. So that's what they normally tell us at the clinic. And then of course later on they become infected. And I think that is the reason. So the core issue here is that number one is people don't use it because they are not aware of it. That's one possibility. Number two, people don't use it, although they're aware of it, because of they thought that their partner is negative. And the next step is that they don't use it because they are already positive. Okay, so that is actually the three things here. And the increased awareness only going to improve the first part of the first group, the one that totally unaware that the condom is actually can prevent STI. And I strongly believe that this first part is actually minority, and probably they are very young person as well who are totally naive. But most people during this day and age with the social media would have aware that condom would provide some protection against STI. But then you would going to get to another, or they're going to move to another group, another level, that at some time they may not put it on when they thought that their partner is clean, and that is actually the major problem. And that is sometimes we see someone who become HIV positive at the age of 32, for example. They have been active since the age of 18, for example. And of course, there are those who positive at the age of 18 when they start to have sex at the age of 16, 2 years. So maybe they have not been using condom right from the beginning. So those are the scenario that we are seeing at the moment.
Thank you, Doctor, for a very insightful answer.
Thank you.
So, thank you, Daniel, for the question, because I think that's also the question from the society that are thinking in their head, and Daniel also have already told Doctor about this. Okay, so I think we have reached the end of the very informative session. So, maybe Doctor give like some advice and words towards them, like who have suffered from this disease, and from the society that have this symptom and sign, but then don't really want to do screening test because they are very scared of the stigma that they have positive this disease.
Yeah. Okay. I think in terms of the last advice, first of all, I think everybody needs to be aware of the risk factors of acquiring STI, and I just listed down here, and I think that's the first step they need to do, which is get to know all the risk factors of acquiring STI. And by knowing the risk factor, then they can put on the preventive measures. And when they do have symptoms, like what I listed down here, then they need to go and see doctors to actually be evaluated. And they can go to the, in all settings, they can go to our clinic rawatan keluarga, which is well versed in the what we call it management, or they can go to the STI friendly clinic set up by the Ministry of Health in Kota Baru to be evaluated, and they are well trained, and they are supposed to be what we call it neutral, as well as professional in in evaluation of the patient with STI. And I think for the student, you can go through this document here by WHO, which recently published June last year, and it is nicely illustrate the way to manage what treatment can be given in a very simple way. And the treatment for the STI, most of them, I mean, apart from of course HIV, is actually very straightforward. It's not complicated, and most of them, again, apart from HIV, HSV, hepatitis B, they are curable. Okay, and so I think for me, this is probably the most important slide. Anyone who are at risk of STI or who have had gonorrhea, chlamydia, for example, syphilis, definitely at high risk of getting HIV. So any patient presented with STI must be offered HIV screening test. Early diagnosis is very important for HIV because we know that successful ART prevent AIDS and result in life expectancy in the general population. And again, HIV is also 100% preventable. So I think finally, I would say that STI is almost as well as sex itself. It is increasing in key population, like we discussed just now. Behavior determine the risk of acquisition, and again, all is preventable. And like you just said just now, prevention is certainly better than the cure. So I think that's all from me. Thank you very much again for inviting. I hope the session is useful.
So thank you, Doctor. That's a very fantastic podcast, I think. And I have been a very big pleasure speaking with you. And thank you for joining us in the SpeakMED. Also, thank you for the